So let's get started here. I know usually we like to wait about a good 5 minutes, but if anybody that's gonna come in, I have no problem of getting them admitted as well. So it should be fine. So that said, I wanted to welcome you guys to the Activate Your Liver Detox Pathways. I'm Maurice, and I see few of you today, which is excellent, who are quite probably serious about optimizing your liver health and metabolic function naturally. Now, before I get started, so type 1, if you've been experiencing symptoms like fatigue, brain fog, or digestive issues that might be related to liver function, or the number 2, if you're here mainly for preventive liver health. I'd love to know who brought you here today. What brought you here today? Both, excellent. Learn more, read detox, excellent. So, whether you're dealing with concerning symptoms or focus on prevention, what we'll discover today could be a complete game changer for your health and energy levels. So, let me start with something uh, personal. See, over the years, I've worked with countless patients who were struggling with mysterious fatigue, stubborn weight gain, brain fog, and digestive problems. Now, they'd been to multiple doctors, of course, had normal blood tests, but still felt, terrible. That's when I began researching liver detoxification pathways and discovered the breakthrough science we're going to discuss today. So what I found was a scientifically validated approach that can actually reactivate your liver's natural detox system. So something that can transform how you feel within weeks. And today I'll share what cutting edge research reveals about supporting your liver's detoxification at the cellular level. So let's start with understanding what your liver actually does. See, your liver is your body's primary detoxification organ, processing over 500 different functions every single day. And it's responsible for filtering toxins from your blood, producing bile for fat digestion, storing nutrients, and of course, regulating blood sugar. Now, think of your liver like a sophisticated water treatment plant. It takes contaminated blood from your digestive system and other organs, filters out the toxins, neutralizes them, and sends clean blood back to your heart throughout your body. Now, your liver detoxifies through two main phases. You have phase 1 detoxification, uses enzymes to break down toxins into intermediate compounds. And you have phase 2 detoxification, converts these intermediates into water-soluble compounds that can be eliminated. But here's the critical issue. When these pathways become sluggish or, let's say, imbalanced, toxins can actually become more dangerous than when they actually entered your body. So when your liver detoxification becomes compromised, you might experience chronic fatigue and low energy, brain fog and difficulty concentrating, stubborn weight gain, especially around the midsection, digestive issues and bloating, skin problems and premature aging, chemical sensitivities, and of course, hormonal imbalances. So here's a quick question for everyone. How many of these symptoms sounds familiar to you? Type a number from 1 to 7 in the chat representing how many you've actually experienced. I know myself, I used to experience chemical sensitivities quite a bit. So if you guys don't mind sharing um, and answering that question would be great. I did have them in the past. Perfect. See, those numbers actually tell a story, and most people don't realize these seemingly unrelated symptoms can actually all trace back to an impaired liver detoxification. So what's happening at the metabolic level when your liver's detox pathways become sluggish? There are several key factors. First, nutrient depletion. Your liver requires actually specific vitamins, minerals, amino acids to run its detox enzymes. And modern diets and soil depletion often leaves us deficient in these critical cofactors. Second, toxic overload. We're exposed to more chemicals, pesticides, heavy metals, and environmental, specifically toxins, than ever before in human history. And this actually overwhelms your liver's capacity to process them effectively. And third, enzymatic dysfunction. Your liver uses hundreds of different enzymes for detoxifications. When these enzymes become sluggish due to nutrient deficiencies or genetic variation, the entire system backs up. Now, here's where it gets really concerning. When phase one detoxification is working faster than phase two, and I've seen this quite a bit, you create a dangerous bottleneck. So, phase one creates toxic intermediates that are actually more harmful than the original toxins. And if phase two can't actually keep up, these intermediates circulate in your body, causing inflammation and cellular damage. And this is why some people feel worse when they actually start a detox program. They're ramping up phase one without properly supporting phase two. So this is where the breakthrough comes in. See, most liver support supplements provide genetic nutrients that your body then has to convert it into usable forms. But enzymatic substrates work a bit different. See, unlike basic supplements, enzymatic substrates are pre-converted compounds that can actually directly activate your liver's detox enzymes. They bypass the conversion process and go straight to work supporting both phase one and phase two detoxification in a balanced way. The key isn't just supporting your liver, it's providing the precise enzymatic substrate your liver needs to reactivate its natural detox pathway at optimal levels. So let me check with everyone. Type clear in the chat if you're following this critical information, or more info if I need to clarify anything before moving on. Perfect. So it's clear with everyone. Okay, let's move on. So now let's examine the peer-reviewed research that actually demonstrates the effectiveness of enzymatic substrate therapy for liver function support. Two significant clinical studies have been published on these specific enzymatic substrates, providing compelling evidence for their therapeutic potential. So the first groundbreaking study was published in the American Journal of Clinical and Experimental Medicine and focused on patients with chronic hepatitis C. Here's what the research discovered. 36 male patients with confirmed hepatitis C virus HCV genotype 1 infection, randomized single-blind controlled trial lasting 56 days, and control group 18 patients received diluted sucrose solution. Treatment group 18 patients received combination of 4 enzymatic substrates. Of course, they received the cytixavir, Cyrozim, Ergozim Plus, and Propulzim. And the results were remarkable and statistically significant. So what we've seen is the liver enzymes improved. And you know how we do the biomarkers, blood tests on liver enzymes? So we have AST, it's one of the liver enzymes. Actually, we seen a 50% reduction, ALT a 38% reduction, and GGT was a 71% reduction. And the ALT and the GGT, which is part of your biomarkers for the liver, significantly reduction began at week 4. So after 4 weeks of utilizing the supplementation, and AST significant reduction began at week 6. All improvements were sustained through the 8-week study period. Now, in the second study, published in Cancer Research Journal, examined the effects of Cyrozim on liver cancer cells. And the study was designed on 4 liver transplant patients with hepatocellular carcinoma, liver explants refused with 15% Cyrozim and 15% sucrose control, 10-day monitoring period with biomarker analysis. Now, here's the remarkable anti-cancer results. 50% reduction in tumor volume compared to control, decreased cancer cell invasion in treated tissues, suppression of reactive oxygen species, short for ROS, production, and maintained low lactate dehydrogenase levels, indicating preserved healthy tissue integrity. So those peer-reviewed studies demonstrated that enzymatic substrate not only reduced, but they supported healthy liver enzymes level and a compromised liver function. It's shown measurable improvement within 4 to 6 weeks, which is unheard of because a lot of supplementation, sometimes they can take anywhere between 6 months to 12 months. So because of the bioavailability of the enzymatic substrate, we've seen it in such a short time frame. And of course, they provided antioxidant protection at the cellular level, support the liver's natural detoxification process, and demonstrate excellent safety profiles with, of course, minimal side effect. So the key point, these weren't people with severe liver disease. The hepatitis C patients had chronic persistent liver enzyme elevation, similar to what many people experience from metabolic, let's say, stress, environmental toxins, and of course, poor dietary choices. So here's a question for you. Before today, did you realize that target enzymatic substrate could provide measurable liver support with results visible in standard blood test? Type yes or no in the chat, please. Perfect. See, the supporting the liver enzymatic pathways can actually produce real measurable improvement in liver function markers in no time, which is pretty amazing. So what exactly are these enzymatic substrates that achieve such impressive results? See, the studies use formulation containing cyrosine and propylzine, specialized compounds that actually work through sequential enzymatic activation. So these aren't your typical liver supplement. They work by providing your liver cells with the exact molecular substrates needed to reactivate dormant detox pathways. So as you see there, phase 1, which is the cytochrome P450 support. So for phase 1 detoxification, this specific enzyme specifically is a cofactor that activates the cytochrome P450 enzymes, the NADPH support for electron transport, molecular oxygen carriers for oxidation reaction, and protective antioxidants to actually prevent free radical damage. Now the phase 2 detoxification, that's when usually it supplies glutathione precursors and recycling compounds, sulfation pathway substrates, methylation cofactors including activated B vitamins, and glucuronidation supporters, and of course amino acid conjugation enhancers. So together, they actually create a comprehensive approach that addresses liver detoxification at the cellular level, supporting both phases in perfect balance. So what makes this approach so effective is the synergistic interaction between components. So each ingredient enhances the effectiveness of the others, creating a compound effect that's greater than the sum of its part. Unlike isolated supplements that work on, how can I put this, on a single pathway, this comprehensive approach activates multiple detox systems simultaneously while providing the cellular energy needed to sustain the process. So let me check with everyone again. Type amazing if you're seeing how this could actually transform your health, or questions if you need clarification on any part. Okay, perfect. So now let's discuss practical implementation. So based on the clinical research and experience with hundreds of patients, I've developed a structured 12-week protocol to reactivate your liver's detox pathways and, of course, restore optimal function. So the protocol has four distinct phases. Okay, you have number one, which is foundation phase. It's weeks 1 to 2. That's when you actually prepare your liver and gradually introduce enzymatic substrates. Number two, which is activation phase, which is between weeks 3 to 8. Implement full therapeutic doses to reactivate detox pathways. Number three is optimization phase, which is weeks 9 to 11. Fine tune the process and maximize the results. And number four, which is integration phase, week 12, establish long-term maintenance strategy. Now, here's what most people experience. So weeks 1 and 2, which is, we're gonna end up kind of going through quite a bit, but weeks 1 and 2, initial energy improvement, better sleep quality. Week 3 and 4, brain fog begins lifting, digestive function improves. Week 5 and 8, significant energy increases, weight begins normalizing. Weeks 9 to 12, sustained energy, mental clarity, optimal metabolic function. So once you commit to trying this approach for the full 12 weeks, I'll provide you with a complete protocol, including exact dosing, timing, and lifestyle recommendations to maximize your results. So if you guys are ready to take action, please type in your name in the chat, and I'll send you the full protocol to get started on your liver's transformation journey. Now, we've covered groundbreaking information today. So let's kind of summarize the key discoveries. So number one is liver detoxification impairment is the hidden cause of fatigue, brain fog, and metabolic dysfunction. Number two, imbalanced detox phases create more toxicity than they eliminate. Three, enzymatic substrates can reactivate dormant liver pathways in weeks. Four, clinical research demonstrates measurable improvements in liver function and symptoms. And five, a structured 12-week protocol can actually restore optimal liver detoxification. I truly believe this information represents one of the most significant breakthrough in metabolic health and liver function restoration. So the ability to reactivate your liver's natural detox pathways could be the key to reclaiming your energy, mental clarity, and overall vitality. The research is quite clear, actually. The protocol is proven, and the results speaks for themselves. So before we move on to Q&A, I have one final question. What aspect of today's presentation has given you the most hope for improving your health? Please share in the chat. By the way, thanks for everybody that is putting their names out there. I'll definitely send you guys the 12-week protocol with some lifestyle addition as well. and of course, supplementation and how to dose. You'll probably receive that email within the next 2 days, so definitely keep an eye on that. The question, do we send our email addresses to? Yes, sirs. If you get a chance to, would be great. If not, I can look up your registration and grab that from there as well too. Shouldn't be an issue. The question was for Rebecca, what aspect of today's presentation has given you the most hope for improving your health? Information, haven't seen actual research on other supplements and detoxes. Yeah, they haven't been. The problem is we see a lot of supplementation out there, Angelo, but nobody does any specific testing for specific issues such as liver, detox pathways. Nobody talks about this stuff. And that's why, we get a lot of. I've seen a lot of patients over the years. And for example, I had one patient this morning before the meeting. He's been doing a liver detox for the past 2 years and still hasn't been able to regulate his bilirubin as a biomarkers, AST, ALT, GGT. Most of them are in the upper higher level. And he does not know what's going on, why this is happening, even thought he's taking supplementation. So some supplementation, their bioavailability after they actually pass our extreme acidity gut, most of it is actually becomes obsolete. And at the end of the day, your body could only possibly absorb less than 5%. So that's why we tend to see a long-term liver detoxification that is taking very, very long time. And none of the patients end up getting the results they want compared to having something much more bioavailable where you can actually access and actually start seeing results within less than 4 weeks. That's incredible. That's incredible, and that's something we should always look for. Quality over quantity. And sometimes some of these supplementation could be high price, but the price, if you actually do the calculation, being on a product for 2 years or being on a product for 4 weeks and 8 weeks, and you cured your issue, you fix your issue. So the idea is to fix it now and not fix it like 2 years or 5 years or even 10 years down the road. Because this is today when we need the issue to be fixed so we can actually maintain our health. Can I follow this protocol alongside the medication I'm already taking? Georgia, what I can do is once I send you the protocol, yes, you could actually use it with the medication, but would be nice to at least in return get an email from you what type of medications you are using, and I can actually just make sure they do not conflict or actually cause any issue with the supplementation where they actually drop their bioavailability or anything like that. So based on the medication, whether it's blood thinners or others, we can kind of customize it. So if you're taking a specific medication in the morning, we can customize when you can actually take a specific enzymatic substrate so it does not conflict, or the whole idea is for you to kind of get the full benefit of it, because both products could be quite expensive and we just don't want to be flushing, supplements down the toilet because of the medication. A man was on the news here in Washington warning people not to take turmeric, ashwagandha, L-theanine due to liver failure. Can one take too much? Is this true? Do we take cytosine and natural supplements? So the problem is when it comes down to turmeric, first of all, less than 20% of the population can actually utilize turmeric. And the downfall about turmeric, it throws your liver pathways off balance. So that's why in the beginning phases, a lot of individuals, they tend to actually see lower inflammation, but within long-term usage of 3 to 8 months, we've seen enzymes liver actually increase quite a bit. Ashwagandha is known to actually cause liver damage. That's why it is ideally to actually cycle it. Now, I do have a lot of individuals, they actually use ashwagandha for relaxation, they have adrenal fatigue. But usually, whenever we do that, we always go 45 days on, 10 days off, 45 days on, 10 days off, and we actually monitor liver enzymes. It's very, very crucial, especially on ashwagandha. When it comes down to L-theanine, on the other hand, L-theanine is very tolerable by a lot of people. I even use it myself. Um, Not for mostly liver, but it's mostly used to kind of how can I put it? It's good for brain wave to actually activate your brain wave. And what it does is, I call it like the monkey brain. If a person has a monkey brain, that means your brain is running at 100 miles an hour nonstop. L-theanine has the capacity to actually shut that off. So therefore, you can actually be able to focus on a project or focus on certain things you're trying to accomplish. But again, L-theanine, it's a lot safer than turmeric or ashwagandha, and you can actually go as high as almost 10 grams daily with no side effects. What about milk thistle? Milk thistle does work, but it works at a very, very slow stage. It only actually activates pathway 1 and does not really cater much on pathway 2. It start to kind of depend on other supplementation. That's why people actually add tatka and they add possibly dandelion roots and other things. But it is a long term. It's not a short term. So as a personal trainer as well, back in the days when I used to actually work with a lot of bodybuilders, for example, they used to actually take milk thistle and tatka on a daily basis for many years to come to prevent any damages. But the whole idea is not to take something for a long term. Take it for a short term, fix the issue. If you do require it in a year or 2 or 3 years, then you can actually add it again. So you can almost do like the cycle once every 6 months or once a year instead of actually have to worry about taking it every single day. You could take Taka and Sarozin, yes, it does not conflict. How soon after beginning the liver detox protocol can I expect to see measurable decreases in liver enzymes levels and fat content? It varies per individual because, based on the studies, we start to see um, your enzymes of the livers, like such as ALT, AST, GGT, start to actually, some of them change at a 4 weeks, start to see at a 4 week level. And usually by 6 weeks, we start to actually see a little bit more of a biomarker such as AST improvement. So it doesn't mean that you do it for 4 weeks, you stop. You might maybe for your body or based on the issues you're experiencing, I would actually extend it to at least, let's say, 8 weeks, so 2 months. And you feel good, biomarkers are excellent. Then after the 8 weeks, instead of finishing the full 12 weeks, for example, you can actually drop down to a maintenance level just because you got your biomarkers optimized and now you're feeling much better. Um, Mongolia bark for cortisol need to be cycled as well. I'll have to check into that. I'll have to check into that, Rebecca. If you get a chance to send me an email, I can definitely research it a little bit better to see whether it's actually requires recycling or not. I know I've done a lot of research on a lot of herbs and a lot of different international supplementations and herbs. Just specific ones that have to dig a little bit deeper to kind of give you a better answer. Which email do we send you messages on? Here, I'm gonna type in my email, so you guys feel free to shoot me an email anytime. And if I'm not too busy, I'll definitely respond right away. Because sometimes I do get a little bit overwhelmed. Every morning I wake up, I get anywhere between 30 to 50 emails, but I'll do my best to answer as many as I could. And going back to the presentation and the Q&A, that you guys have kind of been asking me as well too. The energy level, the mental clarity, the weight loss, the metabolism, even cholesterol, heart disease, type 2 diabetes, all these are related to a liver issue. There's a reason why the liver has more than 500 different, enzymatic functions. So everything that is happening in your health today is related to the liver more than anything. And the liver is probably one of the best organ that we can actually reverse. Uh, whether it's a fatty liver disease or an issue with the liver. So that's your most important organ. I just bought Cyrovet for my dog. She is 7 pounds. It did not come with dosing. How much and when do I give it to her? Rebecca, if you get a chance to send me the email, and I'll adjust the dosing correctly based on the weight of your dog. So if you get a chance to do that, since I did put my email, I'll definitely send you a full protocol on that. It's 1 ml per kilogram, the side of it. Okay, there you go. So Angelo responded. I hope that helps, Rebecca. If you could give it to your dog on an empty stomach would be excellent. I know sometimes it's hard to actually give our dogs specific things, but if you can actually do it that way would be great, or with a small treat, so it does not cause any issues with the amino acids. But yeah, definitely you could do that. Well, if you guys don't have any more questions, it was actually really nice and it was a good engagement today. I definitely was hoping to get a few more people, even thought we had more than over close to 30 people sign up. But hopefully next time we'll have a few more. Definitely, I'm excited to actually support you guys with anything you require, especially being evidence-based strategies, especially to reactivate your liver's detox pathways and, of course, transform your health. I'll definitely send you guys the full protocol of a 12 weeks. And if you have any questions, feel free to email me back. And or if you have questions about your current medications, just so it does not conflict with the proper timing as well, feel free to email me the medications and I can actually give you a better idea when to take all of them without any friction. In the meantime, you guys have an amazing. Are you planning to do more of these Zoom sessions? Yes, the plan to be bi-weekly, every second Saturday. There'll be an email sent out to everybody a week prior, and it'll be a different discussion on every time on every single time. If you have anything specific, Harris, you wanted to address as well, or you wanted a specific Zoom meeting about, feel free to submit you guys are inquiries. I have no problem of actually taking that info and creating a good presentation for you guys. So definitely keep me updated. Again, thanks for everybody for joining today. In the meantime, you guys have an amazing weekend and we'll touch base. Cheers.